Welcome to our video on knee special tests. In our last video, we discussed the hip special tests, and I hope you found that informative. Today, we're going to delve into the knee special tests, which are crucial for evaluating various knee conditions. The purpose of these knee special tests is to assess the integrity of the ligaments, menisci, and the patellofemoral joint. Each test focuses on specific structures within the knee, allowing us to determine if there are any injuries or abnormalities. By performing these tests, we can gather valuable information to help diagnose the problem and guide the appropriate treatment. Now, let's discuss the Valgus stress test. As you can see in the image, the patient is positioned supine, with the knees slightly flexed at 20 to 30 degrees. The therapist stabilizes the thigh with one hand and applies a valgus stress at the ankle. This test is performed to assess the integrity of the medial collateral ligament, or MCL. A positive finding would be excessive medial gapping or pain during the test. Next is the Varus stress test. Similar to the Valgus test, the patient is supine with the knee slightly flexed. The therapist stabilizes the thigh and applies a Varus force at the ankle. This test is used to assess the lateral collateral ligament, or LCL. A positive finding would be excessive lateral gapping or pain. The Lachman test is used to assess the integrity of the anterior cruciate ligament, or ACL. The patient is supine with the knee flexed to 20 to 30 degrees. The therapist stabilizes the femur with one hand and pulls the tibia anteriorly with the other. Increased anterior tibial translation, or a soft endpoint, indicates a positive result, suggesting a possible ACL tear. Let's look at the anterior drawer test. As shown in the diagram, the patient is supine with the hip flexed to 45 degrees and the knee flexed to 90 degrees, with the foot stabilized. The therapist grasps the tibia with both hands. The test is performed by pulling the tibia anteriorly. Increased anterior translation indicates a positive result, suggesting a possible ACL injury. The arrows in the diagram show the direction of the force applied. This test, along with the Lachman test, help assess the stability of the ACL. Now let's look at the posterior drawer test. As shown in the diagram, the patient is supine, with the knee flexed to 90 degrees and the foot stabilized. The therapist grasps the tibia with both hands. The test is performed by pushing the tibia posteriorly. Excessive posterior translation indicates a positive result, suggesting a possible PCL injury. The arrows in the diagram show the direction of the force applied. All right, the McMurray test, as described on the slide, is used to assess the medial and lateral meniscus. The patient is positioned supine, with the knee fully flexed. The therapist rotates the tibia internally and externally while extending the knee. Pain or a click during this motion indicates a positive result, suggesting a meniscal tear. Now, looking at the diagram, you can see the therapist positioning the patient's leg to perform the test, applying the rotational movements and observing the patient's reaction. Next, we have the Apley test. As shown on the slide, the patient is positioned prone with their knee flexed to 90 degrees. The therapist applies downward compression and rotation to the knee, which is used to assess the meniscus. Then, the therapist applies upward distraction and rotation, which is used to assess the ligaments. A positive finding is pain with compression indicating a meniscal injury, or pain with distraction indicating a ligamentous injury. In the diagram, you can see the therapist performing the Apley test, applying both compression and distraction forces to assess the meniscus and ligaments. Now we have Clarke's test. According to the slide, the patient is positioned supine with their knee extended. The therapist presses down on the patella downward while the patient contracts their quadriceps muscles. The purpose of this test is to assess the patellofemoral pain syndrome, or chondromalacia. A positive finding is pain or an inability to contract the quadriceps muscles. In the diagram, you can see the therapist applying pressure to the patella while the patient tries to straighten their leg, which helps diagnose these conditions. The next test is the Patellar Tap Test. The patient is in a supine position with their knee extended. The therapist compresses the suprapatellar pouch and then taps the patella. The purpose of this test is to detect knee joint effusion. A positive finding is when the patella feels like it's dancing or floating. This test helps determine if there is excess fluid in the knee joint. This is the Patellar Apprehension Test. The patient is positioned supine with their knee slightly flexed. The therapist gently pushes the patella laterally. The purpose of this test is to detect patellar instability or dislocation. A positive finding is when the patient shows apprehension, contracts their quadriceps muscles, or resists further movement of the patella. This test helps identify potential issues with patellar stability. If you found this video helpful, please give it a like, share it with others, and subscribe to the channel. If you have any questions or comments, please leave them below.